Hi, good morning. My name is Winston Tan, a medical oncologist at the Mayo Clinic in Florida. I would like to discuss two of the novel options for patients in the second line setting for metastatic bladder cancer. The two new drugs that are currently available, one known as Erdafitinib and the other is Enfortumab, are the two drugs that I will discuss today. The Erdafitinib is a FGFR3 and 4 inhibitor, and interestingly, in bladder cancer have significant activity in the second line setting. The FDA had recently approved this drug because of its efficacy and ability to prolong progression-free survival in the second line setting, specifically after chemo progression and also PD-1 progression in patients with metastatic bladder cancer. This drug is an oral agent and is prescribed initially at 8 milligrams per day, and then as long as the phosphorus level is normal, that is increased to 9 milligrams daily. The objective response to this treatment is 40%, and the complete response with this agent is 3%, and partial response is 37%. Of note is that 18% of these patients will have stable disease. The median time to response is 1.4 months. The duration of the response is 5.6 months. And the majority of the patients in this study had multiple prior treatment, and the sites of the metastasis include most commonly bone, liver, lung, lymph nodes, upper urinary tract, and lower urinary tract. A total of 99 patients were treated in this study, and of note, 79% had visceral metastasis. And among those patients who received immunotherapy, 59% had a response. And the duration of that response is 5.5 months, and the overall survival is 13 months. This is very encouraging in a sense that patients, after they progress on chemotherapy and immunotherapy, they would have no option or standard options for the treatment of their disease, and there's no other drug that can significantly improve their survival. Certainly 13 months is impressive. I would like to highlight the side effects of Erdafitinib. It is very important in these patients to monitor their phosphorus level because their phosphorus level would increase, and it is important to note that if you try to increase the dose from 8 milligrams to 9 milligrams, the phosphorus level should be less than 5.5. The common side effects of this drug include weakness, tiredness, stomatitis, muscle aches, joint pains, diarrhea, which are very common in this patient, and careful monitoring of the electrolytes would be important in the administration of this drug. The other drug that I want to highlight is Enfortumab. It's a Nectin-4 inhibitor. It is present in 97% of urothelial cancer, and interestingly, in locally advanced disease and also metastatic urothelial cancer, the response rate is 44%. And specifically, these are patients who have been exposed already to chemotherapy and also immunotherapy. Among those patients who have responses, 12% had complete response with no detectable tumor. That is amazing. The median survival was at least 11.7 months. And among those who had not responded to a checkpoint inhibitor, 41% responded to Enfortumab, and 38% of those patients with metastasis to the liver responded to Enfortumab. Most common toxicity include fatigue, alopecia, decreased appetite, and certainly this drug is an interesting and useful drug for the treatment of metastatic bladder cancer. For the Enfortumab, the drug is given intravenously, and day 1, day 8, and day 15 on an every 28-day schedule. Thank you very much.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.